so this is Chris. He's going to be my patient for today. How are you doing, Chris?
Good.
Good. Okay, so today we're going to be doing some manual therapy techniques, more focus on massage today. It's just going to be a lot of techniques that'll help with the chronic swelling that you have. That'll help with the range of motion, and it'll help just break some of the adhesions in there and the fibrous tissue, just to help get a lot of the waste out of there. Is that okay if we do that today?
Yep.
Okay. I did wash my hands before doing this. And he is draped currently. Is it okay if I lift this up to work on your leg or your lower extremities? Okay.
Yes.
So I'm going to be using this lotion over here. Before we get started, you do have any history of congestive heart failure?
No.
Osteoporosis?
No.
Any skin lesions anywhere?
No.
Okay, so it's okay to get started. We did review his chart. So one of the goals is we are trying to get rid of the chronic edema. So we're going to be doing some stroking first to start, and then we're going to move on to effleurage to really get rid of the waste in that lower extremity. Okay, so is it okay if I lift this up?
Yep.
Okay. So I don't want any of this lotion to get on his clothes, so I'm going to just fold this under. Put a little lotion on my hands. We're going to do some stroking first to kind of prep his leg. It might be a little cold. Is that okay? So we're doing the stroking just so he can get used to the touch of my hands. He also has 7 out of 10 pain today. So what we're doing is this can also help with pain via the gate theory. Just because we are applying a non-noxious stimuli to the area. So it'll just help block some pain receptors. So I'm just doing a little bit of stroking. Is that okay? It also just preps the skin, lubricates it a little bit, just because we are going to be doing that squeegee effleurage technique. So we just need to make sure there's enough lotion. So this you can do in either directions. Okay. And so one of the goals is we are trying to get rid of this chronic edema that he has. I'm just going to add a little bit more lotion. So then the next thing we're going to do is effleurage. So that's the squeegee technique. Doing 7 seconds. And I'm kind of just squeegeeing all this liquid to the nodes up here. Just pausing a second because these are where the nodes are. And then I can take one hand off and then do it again. Does this feel okay? Okay. And then once we work down here for a little bit and kind of drain the fluids out to the nodes over here, we can move up to his upper thigh area. I'm just gonna stroking this on, just get more lotion. We can do the same thing. Since it's bigger, I'm gonna use both my hands again and just do that squeegee technique just towards his inguinal nodes. And of course, in a more ideal situation, I wouldn't be kind of hovering over like this. I'd probably be more on the side, but just with the situation we have. So I did a little bit of effleurage, and then since he might still have some like built up sludge in the area, so I'm going to do some petrissage kind of in this upper area just so we can try to get more of the waste out, and then I'm going to perform effleurage again. So So I'm going to just do petrissage and just do some kneading, some palmar kneading, just up here. Kind of affecting more of the deeper tissue in the area. And using my lumbricals. So I'm just going to be doing this for a couple minutes, and then once I kind of break up all the tissue and all the sludge in there that's built up, I'm just going to do effleurage again, just so that we can get rid of that extra waste. And again, I would be probably on a stool or more on his side while I'm doing this. But this is just for a better view. Does this feel okay?
Mm-hmm.
And then after I do that, I might also do some finger pad kneading and just maybe get in these areas as well, and then do some more effleurage. So some finger pad kneading maybe around his knee, just doing some circular motions, or I can do the thumb pad. And then I'd probably do effleurage just one more time just to get rid of the waste that I probably broke up a little bit. And then to just finish it all off, I'll just finish with some stroking, just so that he can feel comfortable and acclimated again. You feeling okay?
Mm-hmm.
Okay. Okay, and then just to finish it off, afterwards we do an activity. I can get rid of these pillows. Okay, thank you. Just right after the massage. Doing okay?
Yep.
And I could probably do a calf stretch afterwards, just because we are working on some active range of motion on his lower extremity. So I can just do a manual calf stretch just like this for 3 sets of 30 seconds. Does this feel okay?
Mm-hmm.
Okay. And that's it. Did you feel okay for today?
Yes.
Okay. Well, I hope to be working with you again soon.
Cool.